lovelies, in today's video, we are going to talk about substance use disorder, or in layman's term, drug addiction. What is really going on in a person's brain when he takes drugs? My ultimate purpose in creating this video is to educate us all, and by understanding them, we may develop more compassion towards them. We will stop the blame and stop passing judgment. So I hope that we're going to learn something today. So what is drug addiction? Addiction is derived from a Latin word that means enslaved to or bound to. So probably those people who have struggled addiction, or if you've known someone who have struggled addiction, could relate to this. Addiction is a chronic disease characterized by drug seeking and use that is compulsive or difficult to control despite harmful consequences. Many people don't understand why or how people addicted into drugs, and they mistakenly think that if that person just have the strong moral standard or willpower, they can stop taking drugs if they chose to. Well, in reality, drug addiction is a complex disease, just like diabetes or cardiac diseases. It needs complex treatment or long-term treatment. So now, what happens to the brain when a person takes drugs? So these drugs or alcohol hijack the brain. It affects the reward circuit. So dinadaya niya yung brain. It's a normal functioning brain. Whenever we do something pleasurable, eating, socializing, sleeping, sex, our brain would release this neurotransmitter, this chemical called dopamine, that gives us pleasure, so that we will keep doing such for us to thrive, for us to survive. So this is God's design for our brain. With drugs, our brain also produces dopamine, but in an enormous amount. High dose of dopamine that it causes euphoria. This euphoria is yung extreme happiness caused by most drugs, although not all, because every drug is different. So that this person will seek these drugs more and more because he is seeking this feeling of euphoria from an enormous production of this dopamine. So hindi na siya kontento sa small dose of dopamine lang released with this normal pleasurable activities. So now what happened? This is very common, like with our patient. They no longer enjoy the usual pleasurable activities like spending time with their kids, spending time with their loved ones, or they are not used with that small dose of dopamine. Kasi nanab na yung katawan nila. The receptors in their brain, hindi na sila kontento. They would prefer to have drugs instead of having their children, or instead spending time with their families. So understanding this would cause us to stop passing judgment to them. Like, why are lots of parents choose to take drugs rather than having that full custody of their children? This is what happens. They become helpless. This is sad, especially with those mothers addicted with drugs, because as much as they want to, they cannot successfully make that bond with their children because they don't find that pleasurable as compared to what drugs can give them. So people may judge them that, why is this mother choosing drugs instead of her children? Well, the reality is that mother is helpless. The message here is it's not that easy because of what drugs has done in her brain. The long-term use of drugs as well could cause this other area or function of the brain, like learning, judgment, decision-making, stress, memory, and behavior. Kaya nasisira talaga ang ulo kapag nagpatuloy ang drug addiction. It really damaged the person's ability to think and behave as a normal individual. So why do some people become addicted to drugs while others don't? So there's three main factors involved here. Number one is biology. It's the genetic composition of a person. So that 50% of those who are addicted into drugs is because of their genetic predisposition. So if you have a strong family of addiction, alcohol addiction, any drug addiction, then there's a high risk for you to become addicted. So better stay away from drugs as soon as you can. Okay, second factor is the environment which the person is exposed to. So there's a lot of influences within our environment where we grow up. Peer pressure, the kind of community we live in. This includes history of abuse, trauma, sexual abuse growing up, stress in life, early exposure to these drugs. Number three is development. Genetic and environmental factors interact with. The younger the person is exposed to drugs, and the earlier that drug use begins, the more likely is a person to progress into addiction. Because areas in the brain that control decision making, judgment, and self-control are still developing. That's why teenagers may be especially prone to risky behaviors, including trying drugs. So research shows that combining addiction treatment medicines and behavioral therapy ensures the best result for treating drug addiction. Because of research, they've found a medication to help these people struggling with drugs, dealing with their cravings, withdrawal symptoms. More good news is that drug addiction is preventable. And results from NIDA-funded research have shown that prevention programs should include families, schools, communities, and the media are effective for preventing or reducing use and addiction. So teachers play a role in here, parents especially. And I just want to share a little bit of this, that as early as like 7-year-old, I am teaching my children to stay away from drugs. I want them to hear this word from me first, and I tell them the detrimental effect of this, so that whenever their friend would tell them someday, they already have this in mind, that hey, I know what drug is, I know what's the effect of drugs, and they could stay away from it. So that's it for today. I hope that you have learned something, and if you've known someone who is struggling with drug addiction, please offer help. Bring them to a medical professional that could actually give them medication to help them with cravings, withdrawal symptoms, on top of behavioral therapy. And I know that most of us would just like yell with our loved ones who are in addiction, or maybe keep on pushing them to change, but this is more than a willpower to change. This is a chemical imbalances going on in the brain that really needs help from a medical professional. So if you enjoy this video, please give this a thumbs up. That just helps support my channel and support my YouTube algorithm. Until my next video, bye!